Hi, I'm Vicky Vaughan and I'm a hypothyroid patient and I have been for 17 years now. I've created a short presentation for the Health Minister because I want to draw his attention to the millions of pounds that I believe are being wasted by the NHS. There appears to be a massive gap in the understanding of the testing and the treatment of hypothyroidism, and the NHS is just not getting to the heart of the matter. So please don't leave us in the gap. I think you'll be pleasantly surprised by the millions of pounds that you could save just by listening to us. We think this presentation is well worth the investment of your time and we hope you enjoy watching it. Before I go on, the information in this presentation has been collated from a number of sources including the NHS, the BBC, the American Heart Association, Harvard Health, Thyroid UK and Stop the Thyroid Madness. Online research indicates that there are 10.2 million people in the UK who suffer with hypothyroidism, and I've recently been in contact with hundreds of them. We think 10.2 million people is a pretty significant number, so we do hope you'll continue watching and listening. Did you know that a healthy thyroid produces many hormones including T3 and T4, which are all essential to keep us healthy? Currently, the NHS only prescribes T4 replacement in the form of levothyroxine. Many hypothyroid patients are suffering from many of the conditions listed on this slide, especially the heart problems, high blood pressure, mental health illnesses, digestion problems, kidney problems, weight gain and foot and leg problems. It's just a matter of time before hypothyroid patients fall victim to the conditions on the previous slide, simply because we're being treated with T4 replacement only. The NHS is wasting millions of pounds each year because it's missing and ignoring many of our symptoms by not testing or treating us properly. The current NHS guidelines for normal are far too wide and many of us fall down the knowledge gap and end up with dangerous conditions which could easily be prevented. Did you know that there's a strong link between heart disease and low T3 hormone levels? There's also a strong link between mental health illnesses and hypothyroidism. As many as 1 in 4 people suffer from some form of mental health illness in their lifetime. So how many of these mental health conditions could be prevented if hypothyroidism was treated properly? To see if these links to lack of T3 were true, I asked some hypothyroid patients if they were taking any other medications alongside levothyroxine. The response was as predicted. Many hypothyroid patients are fobbed off of taking meds for high blood pressure, cholesterol, heart problems, excess acid, and mental health issues, including depression, night terrors, anxiety. We want to know how much all these additional meds are costing the NHS and the taxpayer. The meds, of course, are just the start, because there's the hospital stays, and that means there's a cost of NHS staff and facilities, more drugs, and hospital beds that we thought you were trying to save. Plus, of course, there's the cost to the economy, because there's potentially 10.2 million hypothyroid patients who are taking time off of work. With this in mind, why doesn't the NHS treat us with T3 and T4? This NHS statement I found online says that levothyroxine costs the NHS only £26 per year per patient versus T3, which costs £1,300 per patient. But surely this is a case of mindset myopia. I found the cost of some operations published by the NHS and the BBC, so I calculated the true cost of prescribing T4 only meds to hypothyroid patients. There were 34,174 cardiac ops in 2012 at an average cost of £7,000 per op. This costs the NHS and the taxpayer £239 million per year. How many operations and cash would be saved if T3 was prescribed? High blood pressure costs the NHS £1 billion per year. How many of these patients are hypothyroid? Of course, kidney failure is linked to hypothyroidism and blood pressure, and kidney dialysis costs £30,000 per year per patient. How many of these are hypothyroid? The combination of T3 and T4 is available in the form of natural desiccated thyroid, also known as NDT. And NDT was once licensed and indeed prescribed by the NHS between the years 1934 and 1960s. However, NDT was replaced by Levo in the 1960s because allegedly levothyroxine is more reliable than NDT. A separate independent report states that the British Thyroid Association was unbalanced in its comparisons of levothyroxine and natural desiccated thyroid. And more worryingly, the British Thyroid Association failed to account for harmful effects from T4 only medication. Now, I don't know what evidence was presented to the NHS to form its choice of prescribing levothyroxine in the 1960s, but it appears there's another huge gap in transparency here. So the elephant in the room is, why did the NHS really stop prescribing NDT in the 1960s? Is it any wonder why many hypothyroid patients no longer trust the NHS brand? These patients are self-medicating with T3 from a rising number of unverified NDT importers just so they can feel well again. Something has to be done. The hundreds of hypothyroid patients I spoke to are also fed up with being left in the huge gap. With this in mind, I decided to visit the NHS website to understand its ethics, and I found these values. NHS Value 1. Patients must come first in everything the NHS does. All parts of the NHS system should act and collaborate in the interests of patients, always putting patient interest before institutional interest, even when that involves admitting mistakes. So please explain, NHS, when hypothyroid patients have come first. The evidence in this report indicates that prescribing T4 only is not a healthy option, but would the NHS ever admit to making a mistake? NHS Value 2. Respect and dignity. Every individual who comes into contact with the NHS and organisations providing health services should be treated with respect and dignity, regardless of whether they are a patient, carer or member of staff. So NHS, please explain where hypothyroid patients have been treated with respect and dignity. Value 3. Commitment to quality of care. Quality should not be compromised. The delivery of high quality care is dependent on feedback. Organisations that welcome feedback from patients and staff are able to identify areas for improvement. So NHS, how are you going to treat our feedback? Will you adopt a long-term attitude towards hypothyroidism and be willing to learn and implement new approaches? NHS Value 4. Compassion. The business of the NHS extends beyond providing clinical care and includes alleviating pain, distress and making people feel valued and that their concerns are important. So we ask the NHS to please read the hypothyroid support forums and then do something positive that will make us feel valued. NHS Value 5. Improving lives. The core function of the NHS is emphasised in this value. The NHS seeks to improve the health and well-being of patients, communities and its staff through professionalism, innovation and excellence in care. This value also recognises that to really improve lives, the NHS needs to be helping people and their communities take responsibility for living healthier lives. We have shown you the evidence of conditions caused by being treated with T4 only medication, so please explain to us when the NHS will start improving our lives. If you don't care for us, care for the taxpayers' money. So NHS Value 6. Everyone counts. Nobody should be discriminated or disadvantaged, and everyone should be treated with equal respect and importance. So NHS, when will you begin to treat hypothyroid patients with equal respect and importance? NHS, there's far too many gaps. There's gaps in hypothyroid testing and treatment. There's gaps in your perception of the real cost of prescribing cheap levothyroxine. And there's gaps in living the NHS values. Our message to the Health Minister: the associated conditions, including heart disease, high blood pressure and mental illnesses, are preventable. So please do what you need to do to get NDT, Natural Desiccated Thyroid, relicensed and treat hypothyroid patients properly. We understand that what works for one person may not work for another. Please narrow the thyroid blood test reference ranges and offer patients the full spectrum of thyroid tests. We need transparency. The NHS needs to work alongside and not against Thyroid UK and the other hypothyroid support groups. And we want to know exactly how many hypothyroid patients in the UK are also on other meds for related illnesses and conditions, including blood pressure, heart disease and mental illness. We want the NHS to push hypothyroidism to the top of the training agenda and never stop learning about hypothyroidism. And it's a worldwide problem. Many countries are taking it more seriously than the UK. And did you know that Hillary Clinton also takes natural desiccated thyroid, and her doctor has published a letter that gives NDT the thumbs up? Many hypothyroid patients have found sources of synthetic T3 and NDT for £40 per year per patient, so why is it costing the NHS so much? And finally, here's just a few quotes from some of the hundreds of hypothyroid patients I've been speaking to. One says, "I was on Levo for nearly 20 years and now I'm on natural desiccated thyroid Armour only." Armour is a brand of NDT. Another, "I'm on NDT and don't take or need any other meds." Another one says, "Since switching to NDT, I'm off my asthma meds, off my pain meds, and the biggest shocker of all, I'm off my epilepsy meds and seizure-free for 6 months." Another, "I've had a tiny dose of 2.5 mcg T3 added to my levothyroxine, and I feel immediately alive when it felt like before I was dying slowly. If a few crumbs of T3 can do that, how bad was my T4 only treatment?" And finally, another one says, "I work for the NHS, so it directly costs them a fortune to pay me sick pay for 4 months while they refuse to treat me." So thank you for your time. For further information about this presentation, please contact me, Vicky Vaughan. And if you want some more information about hypothyroidism itself, contact Thyroid UK. Thank you for listening, and we look forward to hearing from you very soon.